So I'm more concerned about the frontline people dealing with the few cases of Ebola that have turned up in this country so far. There will be more. There's no question about it. God only knows how many people have been affected because of the sloppy way these for-profit hospitals have handled this, and the fact that we really have not had public health leadership in this country. We have not had the research and development necessary to work on an Ebola vaccine. Dr. Fauci said in not just testimony today, but he said it before, that had it not been for cuts in the National Institute of Health budget by these filthy, stinking Republicans, they would be well on their way, or they might even have a vaccine. Now, a vaccine is not a cure, but it stops the spread of the disease cold in its tracks, and they would have come up with therapeutic treatment for Ebola. But no, the Republicans cut everything to pieces, and now, of course, they're blaming it on Obama. And they're going to get reelected. They will. And they're going to control the House and the Senate. They will. You don't think so? Just wait. But that's a different topic. Wendell Watson, a hospital spokesman at the hospital in Texas, said, well, he did not respond to specific claims by the nurses, but said the hospital has not received similar complaints. From who? If similar complaints from the nurses? From who? What about the custodial staff? When are we going to hear from them? They're the ones that had to come behind after the visiting hours were over and clean this stuff up. This is what this geek, Wendell Watson, a hospital spokesman, said, quote, patient and employee safety is our greatest priority. They always say that, don't they? And we take compliance very seriously, except maybe in this case, right, you dork? He said the hospital would, quote, review and respond to any concerns raised by our nurses and all employees. We will. Yeah. Here's what the nurses alleged to get specific. Mr. Duncan was kept in a non-isolated area of the emergency department for several hours, potentially exposing up to 7 other patients to Ebola. Patients who may have been exposed to Duncan were kept in isolation only for a day before being moved to areas where there were other patients. Preparation for Ebola at the hospital amounted to little more than an optional seminar for staff. And fourth, in the face of constantly shifting guidelines, nurses were allowed to follow whichever ones they chose. What do you expect? This is a for-profit organization. They don't have time for this. Go clean up the mess. What's the number? What did I say earlier, Kathy? 100,000 people a year die when they go to the hospital by, what's the word, iatrogenic infection? Is that the word, where you go into a hospital because you're going to have your tonsils removed? And you pick up a hideous bacterial or viral infection, and within 10 days you're dead. It was tonsils. The nurse's statement added that they had to, quote, interact with Mr. Duncan with whatever protective equipment was available, even as he produced a lot of contagious fluids. Think about that phrase for a minute. A lot of contagious fluids. When you have one of these hemorrhagic diseases like Ebola or Marburg, do you know what one of those contagious fluids is? Copious amounts of blood out of every orifice in your body, and in the final stages, out of your goddamn pores. That's why it's so hideous and horrible. Duncan's medical records, which his family shared with the Associated Press, underscore some of the concerns that the nurses had. When Ebola was suspected but unconfirmed, a doctor wrote, quote, using the disposable shoe covers should also be considered. At that point, by all protocols, the shoe cover should have been mandatory to prevent anyone from tracking contagious bodily fluids around the hospital. I have seen what copious amounts of blood coming out of a patient who is in the death stage of a disease. I've seen what that does, right, Kathy? We watched her mother die in a very messy, horrific way from tongue cancer. And it's not something you want to see. Trust me on this. Copious amounts of body fluids. When that body fluid is blood, it's all over the place. The Texas Health Presbyterian nurses, by the way, are not represented by the National Nurses United or any other union. The spokeswoman for NNU said the nurses claimed they had been warned by the hospital not to speak to the media or they would be fired. That sounds very familiar, doesn't it? The CDC said Tuesday that 76 people at the hospital could have been exposed to Mr. Duncan after his second ER visit. Another 48 are being monitored for possible exposure before he was hospitalized. And that doesn't include the people on the airline flight with the first or the second nurse who went to, where'd she go to? Akron, Ohio, and then to Florida. So no, I'm not going to talk about Ebola, but I will talk about what these nurses, what the not the first responders, but the frontline people who are dealing with trying to provide palliative care, which is about all you can do with Ebola. Keep the patient alive and see if his or her immune system will kick in and save the person's life, because there's nothing you can do.